what we're looking at today is supporting the needs of individuals with substance use disorders. And the training that we're providing is on, is on providing high quality, compassionate, and effective support to individuals living with substance use disorder, or SUD. In this training, we will explore a service approach grounded in four core principles: person-centered care, harm reduction, trauma-informed practice, and strength-based support. These principles shape not only how we understand addiction, but also how we build trust, promote safety, and empower recovery for every person we serve. So throughout this training, you're going to learn how to integrate these principles into real-world interactions, build therapeutic relationships grounded in respect, and support individuals with SUD in ways that are ethical, compassionate, and effective. Together, these foundations prepare us to serve our communities with empathy, professionalism, and a deep understanding of the human experience. So let's dive into this material right now and take a look at it. So our first slide is about understanding the population. And I'm going to ask if Angela Cruz would unmute and read that top box for us.
Maybe still muted.
I saw her unmute. Try it again, Angela. All right, I think she's making an effort, but for some reason it's not working. So instead, why don't we go to Cassidy, whose face I'm picturing right now, and maybe you can read that top box for us.
Substance use disorder, SUD, is a complex chronic condition impacting physical, mental, and emotional health.
Perfect, thank you. And maybe Eddie could read the second box for us.
You're often linked to trauma, stigma, and systemic barriers.
Thank you. And then the last box, maybe Josh will read that for us.
Requires compassionate, individualized care rooted in respect and dignity.
Thank you. Thank you, all three. So exactly, when you put these three things together, this is the beginning of our understanding of the population that we're serving. And substance use disorder is a complex condition, and it affects both the brain and behavior. It leads to compulsive substance use, where individuals continue to use substances even when they're aware of the harm it causes. And this disorder can manifest through various substances, including alcohol, prescription medicine, medications, and illegal drugs. So the development of substance use disorder can be influenced by various factors, including genetic predisposition, environmental influences, trauma, and mental health conditions. And many individuals with SUD also experience co-occurring mental health disorders, which can complicate the treatment and recovery. So effective treatments for substance use disorder are available and can include behavioral therapies, counseling, and medication-assisted therapy. But the first step in recovery is recognizing the problem, followed by a formal assessment by a healthcare professional. And treatment can vary based on the severity of the disorder, and support from family, friends, and support groups is often crucial for successful recovery. So substance use disorder is also a serious condition that requires comprehensive treatment and support. Understanding the nature of SUD can help reduce stigma and encourage individuals to seek help. So if you or someone you know is struggling with substance use, reaching out to a healthcare provider or support group can be a vital step toward recovery. All right, so let's take a look now at signs and symptoms of it. And I'm going to ask if maybe Chris Mooney would just read all four of those boxes for us.
All right, so signs or symptoms, looks like we got impaired control, social problems, risky use, and drug effects.
Exactly. That's pretty self-explanatory there. So let's take a look at the next one. And I'm going to ask for Kevin to read the slide to us.
We have core needs of individuals with substance use disorder: safety and stability, non-judgmental support, access to mental and physical health services, connections to community resources, hope and empowerment through recovery.
So this is an important slide when we're talking about the core needs of these individuals, because it's by helping to meet each of these needs that we're going to create a safe space for ongoing support and progress. So let's move now and take a look at one of the approaches that we talked about when we first introduced this. And this first one is person-centered approach. And so I'm going to ask someone else, Raphael, maybe you can read this slide for us.
Yes, sir. So, person-centered approach. Focus is on the individual, not the disorder. Clients are experts in their own lives. Collaborative care planning that honors preferences, values, and goals builds trust and engagement.
Thank you, Raphael. Um, so the person-centered approach is a philosophy of care that emphasizes the importance of seeing individuals as unique and valuable. You know, here at Motivational One, we often say that we don't treat addiction, we treat the person, right? The individual. And that's really what we're talking about is this person-centered treatment. Um, and it originated in the disability sector, and since then has been applied across various fields, including healthcare and mental health, education, and social services. That person-centered treatment starts with a plan that is created by using the individual's own language and is consistent with values, culture, beliefs, and goals. So treatment planning begins at the first kind of conversation with an individual about the addiction issue. And person-centered care recognizes that each individual's journey with substance use is going to be unique. Our role is to collaborate with people, not direct them, honoring their goals, preferences, and cultural identities and definitions of progress. Person-centered work ensures that individuals feel seen, feel respected, and that they're included in the decisions about their own care. So let's take a look then at the core principles for this person-centered approach. And I'm going to ask Samuel if you'll read this slide for us.
So, person-centered approach, core principles, individuality, empowerment, collaboration, dignity, and respect.
Thank you, Samuel. So we talked about that. Let's talk a little bit more about each one of these. Individuality, what is that? That's recognizing that each person has unique experiences, preferences, and needs. Empowerment, we hear that word a lot, often in our modern culture, and you'll hear it a lot here at M1. And it's talking about supporting individuals to take control of their own lives and their decisions so that we can foster independence and self-determination. Collaboration, that's involving individuals and their families and all of their support networks in their decision-making process regarding their care and support. And then that last one, dignity and respect, that treating individuals with respect and valuing their contributions is going to ensure that their voices are heard and that they're considered in all aspects of their care. And what are the benefits then of taking that person-centered approach? Well, let's take a look at that. And if Maurice would read that for me, I'd appreciate it. I hope I
I'm sorry.
pronounced his name correctly.
I'm sorry. This is Marquis. What do you want me to read?
If you would read the slide for us.
Well, improve satisfaction, enhance outcomes, stronger relationships.
Exactly. These are the benefits. This is what we're looking for to create by using this person-centered approach. Um, And so improved satisfaction means that individuals are going to be more likely to feel satisfied with their care when it's tailored to their needs and their preferences. And enhance outcomes, we mean by involving individuals in their care, the approach can lead to better health outcomes and increased motivation to engage in their treatment plans. And then those stronger relationships, that's building trust and mutual respect between caregivers and individuals, which will foster a more positive and collaborative environment. So the person-centered approach is a transformative way of providing care and support that prioritizes the individual. And by focusing on their unique needs and preferences, this approach not only enhances the quality of care, but also empowers individuals to lead fulfilling lives. So it's essential for healthcare professionals and support workers to adopt this approach to ensure that the services that they're providing are effective, respectful, and truly centered around the people that we're here to serve. All right. So with that, unless there are any questions, I'm gonna pause here and see if there are any questions. And if not, we'll move on to the harm reduction approach. All right, let me pick somebody to read this one for us. So I'm going to ask Bill if you'll read this slide for us.
Turn my mic on here. Harm reduction approach. The goal is to reduce negative consequences of substance use without requiring abstinence. An example of that would be safe use education, syringe access, overdose prevention like Narcan, and non-punitive support. It recognizes recovery as a spectrum progress, not perfection.
All right, thank you, Bill. So progress, not perfection. So this is an evidence-based philosophy that meets people exactly where they are, right? Harm reduction acknowledges that healing does not always happen in a straight line. It's not always this linear process. And by reducing risks and supporting safer choices without judgment, we're going to promote health, dignity, and survival while creating space for people to move toward change at their own pace. So harm reduction in therapeutic care is a philosophy and set of strategies aimed at reducing the negative consequences of substance use without necessarily extinguishing the behavior. It focuses on improving the health and functioning of individuals with substance use disorder, often through reduced use and engagement in unhealthy behaviors, while encouraging safer circumstances. The approach is non judgmental and respects the dignity and rights of people who use substances. And it's based on understanding that drug use is a complex phenomenon and that some ways of using drugs are clearly safer than others. Harm reduction principles are applicable not only to substance use, but also to other health risk behaviors such as sex work, eating disorders, and tobacco use. So next we're going to take a look at trauma-informed care.
Pop Casey in there. She's got her hand up.
I see that. Casey.
Yeah, I just wanted to mention, sorry, okay. I just wanted to mention, I know in the Loveland office specifically, there are a number of people on the team who've gotten the Narcan training and that they have like support kits readily available in the office. And so while we don't necessarily want to take the approach as coaches and mental health professionals, people working for a licensed facility that are facilitators, you know, I can see the value definitely of taking a non-judgmental approach and not making people feel like if you slipped backwards in some way that that means that you can never be successful. And, you know, I see examples all the time of people on our team really living that and being there for people that we help. And so I just want to say I see that and I'm grateful for it. That's all.
Good comments. Thank you, Casey. All right, so trauma-informed care. Let's see. Well, Casey, your mic was open. Why don't you read this one for us?
Okay, so trauma-informed care has some underlying principles: safety, trustworthiness, empowerment, collaboration, and choice. It acknowledges that many people with substance use disorder have experienced trauma, and as Terry mentioned earlier, there may be co-occurring disorders that are really impacting them in their recovery journey. And it avoids re-traumatization while also promoting healing of relationships.
Thank you, Casey. So a trauma-informed lens reminds us that substance use and trauma are deeply interconnected for many individuals. Behaviors are often adaptive responses to past pain, right? A trauma-informed approach emphasizes emotional and physical safety, choice, transparency, and empowerment. It helps us avoid re-traumatization and fosters environments where trust can grow. So trauma-informed care is an approach to treatment that recognizes and responds to the impact of trauma on individuals. And it's a strength-based framework that emphasizes physical, psychological, and emotional safety for both providers and survivors. And it creates opportunities for survivors to build a sense of control and empowerment. The approach requires understanding a patient's life situation, past and present, to provide effective healthcare services and prevent re-traumatization. So overall, trauma-informed care aims to create a supportive environment that acknowledges the effects of trauma and promotes healing. All right, next up, we're going to talk about strength-based practice, and I'm going to ask James to read this slide to us.
Strength-based practice. Focus on what's strong, not what's wrong. Empowers clients to identify skills, resilience, and potential. Encourages self-efficiency and sustainable growth.
All right, thank you, James. So strengths-based interactions and support focus on identifying and leveraging the strengths and resources of individuals, their families, and the community. It focuses on what's going well and the strengths of the people that we serve and resources that they do have available to them, not areas of lack. So strength-based practice takes a holistic approach that focuses on the strengths and resources of individuals, promoting resilience and well-being through collaboration and support, and empowering clientele to consistently demonstrate skill. And it shifts the focus from what is wrong to what is strong, enabling clients to take charge of their lives and achieve goals. And this encourages their sustainable growth. So let's take a look at the core principles for this, and I'm going to ask Cheyenne if she'll jump in and read this slide for us.
Strength-based core principles. Communication should inspire confidence, not compliance. Replace judgment with curiosity. Build on progress, no matter how small. Encourages collaboration.
Thank you, Cheyenne. So the primary objective of strengths-based practice is to enhance the individual's independence, their resilience, as we said, and the ability to make choices using these core principles. So communication, let's talk about that. Clients are more likely to engage in the process when they feel that their strengths are recognized and that those strengths are valued. Curiosity, when we are curious in our assessments and really work to find out what is important to our clientele, we develop goals that are actually important to those that we serve. We work with them to build strategies for success that are sustainable in the long run. Building on progress. We work with the client to set goals and develop strategies that build on existing strengths. And encouraging collaboration lets clients be seen as experts in their own lives, and their input is valued in that decision-making process. So by focusing on what the clients can do, we can help them lead more fulfilling and autonomous lives. And the approach also aims to reduce the need for additional support over time by fostering a sense of self-sufficiency and resourcefulness. So some of the common barriers to communication then are what we want to think about when we're talking about strength-based core principles. And so I'm going to look for Stacy. I'm hoping you can step in here and read this slide for us. And
helps if I undo my mic. Huh? Using deficit language, what's wrong, interrupting or assuming, not validating experiences, or forgetting to celebrate small wins.
yeah, exactly. And you can kind of see really why these would be common barriers to effective communication. I mean, so think about the idea of deficit language, and that's just a way of speaking or thinking that focuses on what an individual or a group lacks, right? Instead of what they may actually bring to this to their own recovery. And so it's important. I think this is a really important point. And I just lost my screen here, so apologize. Anyway, so you can see why these things would make it more difficult for someone just to open up and trust. So very important that we try to avoid these common barriers. And so let's take a look at some ways to avoid that. So what's the alternative then to using deficit language? It would be used strength-based language. And some of the examples would be, instead of saying something like "you're non-compliant," and you might say, "you're still working on consistency." Instead of saying you failed at reaching your goal, you might say that you made progress towards your goal. It's so that we're acknowledging still that movement has been made and celebrating that. Saying things like "you don't care," as opposed to "you seem discouraged, so how can we help?" And you're difficult. You're being difficult, instead of, I can see that you're passionate about your needs. you can see how you can just take, you're sending the same message, but you're sending it in a way that emphasizes, again, the strengths that you are seeing as opposed to the deficits that identifying those things that you're not. So I hope this is making sense. So communication skills then are key. And so here are 5 key communication skills. And think about it. This is not only true in what we do professionally, but also in our regular lives, right? So I'm going to ask if let's see, I'm gonna pick on Samuel again and ask him to read these for us.
So 5 key communication skills: active listening, be fully present, empathetic reflection, mirror emotions, not just words, positive reframing, find the opportunity in the obstacle, curious questioning, ask, don't assume, and celebrating strengths, reinforce growth and effort.
Thank you, Samuel. And you can see that these really kind of link together with the past couple of slides that we're talking about. And active listening is, really kind of when you think about it, encompasses all the rest of this, right? And that idea of being fully present. I have a saying that we talk about internally that is be here now, right? There's a lot in our culture that sometimes tends to celebrate things like multitasking, for instance. Um, and one other way to look at multitasking is that you're not really fully paying attention, right? And so it's a good reminder of what just focusing and listening and showing people that you understand what they're saying and what they're feeling through your reflecting what they're saying to you can really go a long way to establishing the communication, a two-way communication. So looking at this, we're going to talk about using strength-based communication as a team as well, because as I said, these concepts, when we're talking about listening and communicating, apply in various arenas. So I'm going to ask if Josh will read this one for us.
Give positive feedback during meetings. Model the language with coworkers and clients alike. Keep a strength board where wins are shared weekly.
Yeah, all great ideas for team building, right? And especially the giving, one thing that we like to do is this one good thing, giving positive feedback to me is something that we do on our leadership meetings. And the reason is obvious, it's easy to overlook sometimes some of the wins and things that individuals are contributing on a daily basis. And so this helps us not only recognize them, but certainly helps them recognize their own value that they're bringing. So very good things. So there are also some prompts that when you think about it are strength based. So when you're trying to get people to open up, what are some of those positive ways of getting them to open up and communicate? And Eddie, if you would read this slide for us.
Sure. So quick strength-based prompts is what's something that went well this week? What strengths helped you get through that? What's one small step forward you're proud of?
Great stuff. Thank you, Eddie. Great openings to get people to think positively and then start to open up and see whether it's from a team or an individual perspective, start looking at things from a positive way. So now I want to move into a practice scenario here, and it's something that we want you just to think about here. So I'm going to ask if, let's see, if Bill, if you'd read this slide for us, please.
The scenario, a client's missed 2 appointments without calling ahead to cancel. A poor response would be, you keep skipping sessions. You can't be serious about your success. Develop some strength-based ways to respond to this type of incident.
Thank you, Bill. So obviously this poor response, some clear deficit language being used there. And so I'm wondering if I could get some people on this to give us some alternatives, ways that you might send the same message, but using that strength-based language that we've been talking about. So I'll look for some hands to go up so that with your suggestions. All right, I see. It looked like Eddie got his hand up first, so I'm gonna go to Eddie, and then we'll come to some others and hear your examples.
Okay, so we could say, I've noticed that you've missed a few sessions. Is there something that I can help you with to making them?
All right, thank you, Eddie. Bill, can you give us another example?
There's having missed these sessions, tell me, is there something that's going on that you would care to share with me that has caused you to miss these appointments? What can we do to help?
Thank you, Bill. And I thought I saw another hand up, but it seems to have did there. Raphael.
So the way, I will approach that is just understand to me is if transportation is an issue or anything that's preventing this person from missing these appointments, and just kind of figure out how to assess the needs of the clients as I would approach it. And
Thank you, Raphael. And those are good
so,
comments. Give me an example of how that might sound.
okay, how my sound.
Yeah.
So I noticed that you missed a couple of appointments. And is there anything that's going on in your personal space that not allowing you to make your appointments? And then I just base from there and assess the needs of the client.
So you're probing and to try and get there, and all of you are kind of taking that approach. I want to caution on one thing, right? When we talked about deficit-based language, about starting out with what they're doing wrong, right? What about starting out with what they're doing right? So if they've missed a couple, maybe starting out with something about, how much progress they're making towards their goal, right? So again, when we're talking about being strength-based. So let's get some more examples out here.
I don't. Can you hear me?
Yes.
Can you guys? Okay, because I don't know why my hand raise thing is not working.
I thought I saw your hand
But
go up, Kevin. It dropped down for some reason. It disappeared again. But go ahead.
yeah, it keeps doing that. Well, so I was gonna come initially where Bill was coming from, always just practice care and concern, and basically asking them. But going off what you just said, I think going in with an encouragement and like you said, pointing out something that they're doing good, and we had a really great 3 weeks. I've seen the last couple of times something has been slowing down. Is there something been going on? I think you've made a lot of progress here. You're doing this, and just encourage, because if something's going on and it's problem related, sometimes encouragement can get them back on track. So I will come in with that and just pointing out the good things that's been going on throughout our assessment, our sessions.
Yeah, good comments, Kevin. In our values, we talk about motivate and inspire, right? And so the idea here with not using the deficit language, but using strength based, is to encourage, right? By showing them how it's really in their grasp and how well they've been doing. So finding that strength based upon their past behavior, and you're really saying that getting them to think about how we can build upon that. So some good examples. Before I move on, anyone else want to contribute to that? I don't want to leave anybody out of that conversation. All right. I think we got some good examples of so thank you all for participating. So look, motivational one has a commitment to this stuff, and so I'm going to ask. I mean, I think those of you, you've all been through our training. I think most, if not all of you, have heard from me directly, heard from Bill, from Casey, and usually from Mel as well. And so you all understand how serious we are about this stuff. I'm going to ask Casey to read this for us, but this is Motivational as one's commitment to this process that we're talking about.
So our commitment is to provide person-centered recovery, coaching, and peer support, to integrate harm reduction into all programs and outreach, to maintain trauma-informed environments across all facilities, to foster strength-based, empowering communication, and to collaborate with community partners for holistic care.
Yeah, thank you. Okay, Casey, again, the key is that we practice the strength-based communication process because we want to build that resilience and trust internally as well as with our clients. So it is our commitment that not only are we talking about and training this to you, but that we commit ourselves to practicing this way as well. So how we support our clients is also part of this commitment that Motivational One works. And I'll go ahead and read this one. But intake and assessment that's tailored to individual needs. And what that means is that right now we're investing in a process for intake that would make this more accessible simply by removing a lot of the hassle. We already know that we deal with a lot of resistance when we're talking about trying to treat individuals and help them with their substance problems. And the harder we make it for them to access our therapy and the benefits that we provide, then the more people that we're going to lose. And so this commitment that we're making, that we're going to make sure that we make this as streamlined as possible, and also that there's no one size fits all. That we are, as we talked about earlier, that we're coming to people from where they're at and what they're bringing to this, and that we're tailoring it to their own needs. Peer-led recovery support groups, that's what we're providing here, right? To make sure that they understand and receive the support, not only from, from their own, infrastructure, but also from ours, right? And that they can learn from each other. Educational wellness, coping, and relapse prevention. Remember, we're not treating addiction; we're treating the entirety of a person. And so it's important that we look at all these strategies to make sure that we are equipping people to not only deal with this in the moment, but also well into the future. Consistent follow-up and accountability, absolutely key to achieving what we are trying to do. And then access to housing, employment, and healthcare services. We spend a lot of time, Bill personally, for instance, spends a lot of time in outreach to different aspects within this community, trying to make sure that we are building a total support network that we can leverage. And so these are things that we are absolutely committed to. I'm going to talk a little bit now about the Motivational One philosophy, but first I'm going to ask Bill to read this slide for us.
Every person deserves dignity, hope, and opportunity. Recovery is personal, it's dynamic, and it's lifelong. And to empower individuals to build meaningful, substance-free lives one step at a time.
Thank you, Bill. I think if as you read these things, if you reflect back also on the values that we've talked about, what our mission is, what our vision is, you'll see that it embodies this philosophy, this belief that we have in each individual's dignity, hope, and opportunity, regardless of the circumstance in which they find themselves. And we want to help them with recovery through this personal, dynamic, and lifelong approach, and empower these individuals to go and to really take command of their own lives and their own futures, and one step at a time build this new future. And that idea of building is something that we believe in very, very, very. We believe in it very strongly. So I hope that this is being helpful. Moving to our conclusion, the idea is this: that we want to lead with empathy, integrity, and motivation. And in order to do that, it can't be something. It's not like a suit, right? You don't act one way and behave one way, and then walk out and put on your integrity suit, and your empathy suit. To be successful at this, it has to be a habit. It has to be something that you practice all the time. It has to become a reflex for you. And so, we are all here because we're trying to make a difference. It's why we started this company. It's why you're here. And it's the passion that I think we all bring to this thing. And it's this idea that we can make a difference. And you have to believe in that, because it's what you're doing every day. And these small contacts, these small outreaches, these things that you may not think are having that big a difference. But I will tell you that the impact ripples outwards. And you sometimes don't even know how much impact you're having on another person's lives. And then through degrees of separation, other lives that are connected to those lives that you're directly connecting. But what you're doing, by dealing with people on this individual basis, can and will ripple outward. And you see what we say here: small shifts in words lead to big shifts in outcomes. That approach, taking that time to master these approaches so that you are the most effective, this is how you'll make that difference. Bill.
I just wanted to take a moment and reinforce that Moto One is not just a company; it's our values. MOTO1: motivate and inspire, operate responsibly, take the initiative, always be improving, ongoing improvement, and acting as one team. These are things that are at our core. And just like Casey said, I see it. I see our values every single day. I watch WhatsApp and I see, hey, I got somebody that is there anywhere that mother and child can be housed? And I see all these responses. That's one team. That's everybody collaborating to make sure that this one client and her child have a place to stay. That's part of our values. And I just want to just repeat those every opportunity that I get so that you not only believe that we believe it, but you will believe it as well and you'll operate that way.
Well said, Bill. Thank you. That brings to an end of what I was here to talk about. I hope it's been helpful to you. I'll open it up now to see if you have any additional questions. Otherwise, I'm going to get out of your way and let you get on with the rest of your training today. But before I do any of that, thank you for your attentiveness. Thank you for participating with me so that you didn't have to listen to me drone on for a half an hour. And also, thank you for being here and for your dedication as always.